Ministry to strengthen devolution agenda. Herald, top stories, Finance and Economic Development Minister Professor Mthulin Finance and Economic Development Minister Professor Mthulin has said the criteria used by government in allocating devolution funds is in the process of being reviewed to ensure equitable distribution of resources. The devolution agenda, operationalized by the Second Republic led by President Mnangagwa, has assisted previously marginalized areas in realizing their full potential in service delivery. The policy is one of the major anchors of unity, which encompasses inclusive development to promote representative, accountable, participatory, inclusive governance and socio-economic development. Devolution was adopted as a key component of the new constitution of Zimbabwe, which promotes democratic participation in government by all citizens and communities and devolution of power and responsibilities to lower tiers of government in Zimbabwe. Ministers of State for Provincial Affairs have been tasked with championing development programs in their provinces. The discharge of that mandate is being closely monitored by the Office of the President and Cabinet. Speaking in Parliament during a question and answer session, Prof. Ncube said consultations between government and relevant stakeholders are underway to review the formula. The current intergovernmental fiscal transfer allocation for devolution funds is based on the agreed formula, which takes into account poverty incidences, population size and also the infrastructure deficit in each of the provinces. However, consultations are underway with the key stakeholders to review this formula so that it incorporates the base mix to ensure optimal equity is achieved, he said. Prof. Ncube said while sharing resources, government takes into account areas in desperate need. I would like to assure you that the government always tries to ensure there is an equitable distribution of resources across our provinces. Of course, as we share these resources, we also take into account areas of desperate need, he said. The minister said under the Emergency Road Rehabilitation Program 2, ERRP2, every province has an opportunity to see an important road or a national road being attended to. Under ERRP2, government is undertaking extensive infrastructural development projects through the construction, upgrading and rehabilitation of roads to enhance the transportation of goods and people in line with Vision 2030. Prof. Ncube said the 2022 national budget has also allocated resources that ensure health institutions are provided for with minimum standard equipment package for each level of care, with contracts worth $8.7 million having been signed. He said the logistical arrangements towards delivery of the equipment is already underway. In addition, government is constructing and upgrading various hospitals and clinics. We have got Lupane Provincial Hospital, Mpilo Hospital and Victoria Chitepo Provincial Hospital, said Prof. Ncube. Also, we are building additional mini hospitals. We have the first one built in Harare South in the Hopley area. It is a fantastic mini hospital with state-of-the-art equipment, and the next one is being built in Cowdray Park, and it is now at roof level. The 60-bed state-of-the-art polyclinic, which the government in partnership with a United Kingdom health organization is constructing in Cowdray Park suburb, is expected to be completed by end of October. The polyclinic is expected to boost the suburb's healthcare provision and bring health services closer to residents of Cowdray Park, Bulawayo's largest suburb with more than 16,000 households. The next will be built in Zvishavane, and that is also going to start soon. After Zvishavane, we go to Ranyerero in Chimanimani before moving to Hwedziv and then Umzingwane, said Prof. Ncube. Government, in partnership with NMS Infrastructure Limited, a British company, is building 30 polyclinics around the country through a US $200 million loan facility from the United Kingdom government. The minister said the health facilities will be built systematically in the next few months. Responding to a question raised by Kambuzuma legislator Mr. William Madzimir on the alignment of the national budget to the National Development Strategy (NDS1), Prof.Cube said the budget priority areas and programs are derived from the economic blueprint. It is important to note that not all NDS1 projects and programs can be implemented in a single fiscal year, since the NDS1 is a medium-term economic blueprint which will be implemented on a multi-year approach, he said. In that regard, government is in consultation with all stakeholders including parliamentarians to identify priority areas to be implemented during each fiscal year for the 5-year period. Prof.Cube said government is also making every effort to tame inflation and limit it to the SAD benchmarks in the medium term. According to Zimstat, the official statistical agency, the country's inflation stood at 256.9% as of last month. Already you have seen some good results from the recent principal measures on month-on-month inflation, which is beginning to turn downwards, said Prof.Cube. The minister said the economic transformation agenda under the NDS1 has seen transformation in the infrastructure space, road construction and dam construction. We are seeing slow burn transformation in the energy supply infrastructure subsector. We have seen even transformation in the management of public finances, and it shows that we have now been upgraded in terms of budget transparency, he said. We are now number 3 in Africa, after South Africa, Berlin and Zimbabwe. We have seen transformation all the way and we will see more going forward.